I'm Peter Sanders. I'm clinical lead at Dental Confidence in Southampton. Been in Southampton for about 30 years working, probably a little bit more. This particular practice, which has been an implant referral practice for many, many years, as it sounds, simply attracts referrals from colleagues. What we provide is the whole range of implant dentistry, from simple treatments through to more complex augmentation when it's needed. I qualified in 1981, a long time ago, worked my way through general practice, private mixed practice, and have been solely providing implant dentistry for the last 15 years. So our treatment model is all about accepting the patient, giving them expert advice and treatment, and then returning them to you, hopefully happy with the experience they've had. So implant dentistry is a very broad subject. It can be at the very simple end of things, a very short, quick, immediate treatment. At the other end of the spectrum, where there has been more bone loss, then we may find ourselves applying different augmentation techniques, sinus lifts, bone grafting. The patient journey for implant treatment is very varied. When I started providing implants more than 25 years ago, it was a very long, methodical, drawn-out process that would take a year. Technology has improved, techniques have improved, and of course, experience helps a lot in that we're now often able to provide patients with treatment that's very, very quick, even treatment in one day. A lot of what we do is digital. We've got optical digital scanning as a very useful tool. So we're able to scan a patient optically as well as radiographically before we start, bring those two technologies together so that we can design and have fabricated the final restoration, or a long-term restoration, before we start placing the implants. Throughout treatment, of course, we remember that they're not our patients. In the long term, they're yours. So we make sure at the end of treatment that we give you back the patient, a happy patient, with some information about what we've done, and they're your patient thereafter. Except that we do like to maintain and look after the treatment that we provided. So we would like to have a review after the first year, and then periodically thereafter, to make sure that everything is done to give the best outcome for the implant treatment they've had. We measure our success not just by how long the implant lasts. I mean, they last, for most patients, a lifetime. Patients come with a variety of expectations. Good referrers have well informed their patients, so they know pretty much what we're doing before we see them, which helps. And of course, we provide information to the referrer so that they feel comfortable talking about implants before the referral. The patient experience is a very personal one, but it's one that we share. And honestly, the most empowering thing that we find from patients is how often they are completely transformed, not just physically, but emotionally, by having their smile restored.